పూర్ణిమ ప్రిన్స్ లో కళ్యాణం కమనీయం సేల్స్ ప్రతి 15,000 కొనుగోలుపై ఒక గోల్డ్ కాయిన్ ఉచితం.
Dr. P. Vinay Kumar, Senior Consultant, Gastroenterology. Dr. Vinay Kumar is a highly respected clinician and expert in the field of surgical gastroenterology. Known for his extensive clinical expertise and commitment to patient care, he has successfully managed numerous complex surgical cases and has earned immense respect from both patients and the medical fraternity. We are delighted to have him join us for this important occasion. May I please request our guest of honor, Dr. P. Vinay Kumar, to kindly say a few words for us.
At the outset, I'd like to thank Vijay Bhaskar for inviting me for this function. Vijay Bhaskar has been one of the most ethical doctors I've come across, let me tell you. I would also like to thank our Honorable Deputy Chief Minister, Mr. Mallu Bhattu Vikramarka Garu, for gracing this occasion and inaugurating this CT scan. I just want to say I'll take a couple of minutes. I hope you don't mind. Already we are quite late. But I always keep thinking that we need to go back to the age where we need a physician for the entire body. We've now specialized so much. I took up to surgical gastroenterology, and the specialization is so limited that I'm failing to see the other body parts. And that's where I think it's very important that we need to go back to the family physician tradition which was there. Unfortunately, or fortunately, I'm one of those who believe that 80% of the diagnosis is made through question answers with the patient and examining the patient. The investigative part comes only as a corroboration to what I have concluded through my investigation. Unfortunately, today what is happening is, the moment a patient comes into my clinic, either when I was in Apollo as a senior surgical gastroenterologist at Apollo, I was one of the first laparoscopic surgeons in the state. When the patient comes into my room, the first thing he does is to put an ultrasound report or an endoscopy report in front of me. I invariably ask the patient whether I am supposed to treat him or that piece of paper. That is how it has become. I keep joking around that, like a IT professional, when he wants to go into his software office, like the way he needs to swipe his card at the door before he is allowed to enter into the IT office. Similarly, there are some hospitals in which even the watchman seems to be holding an endoscope, and until the patient takes that endoscope in his mouth, he is not allowed into the hospital. That's how things seem to be. And that's where I'm saying that we need to go back to the area where we need a family physician who examines you, makes a diagnosis, and comes to a conclusion, and then the investigative part starts. Now, why I said Vijay Bhaskar is one of the most ethical persons is that when I say, Vijay Bhaskar, I have this doubt with this patient, and I'm not very sure of the diagnosis, I'm sending him to you. Can you do the CT scan? Vijay Bhaskar invariably says, sir, let me first do an ultrasound. Let me come to my own conclusion, and if the ultrasound is inconclusive, only then I will go to the CT scan. Now, these are the days when a lot of corporate hospitals, as they see a patient coming in, they start thinking, how is my water bill going to come today? How is my current bill going to come today? How do I pay my consultants? So start writing investigations, thinking on those lines. Whereas I've seen Vijay Bhaskar, if I send 10 patients for CT scan, he calls me back and says, sir, these 3-4 patients or 4-5 patients don't need a CT scan. I have come to a conclusion with an ultrasound. So that is where I think hats off to VISTA, hats off to Vijay Bhaskar. I hope you continue to do well because you are one of those rare diagnostic centers in the city of Hyderabad. And I wish you all the luck with this new CT scan, which he says that I have not yet tested it, but he says that within 30 seconds the CT angio can come across. And we will also know whether the patient is likely to have a heart problem in the next couple of years. Since India, especially Telangana and Hyderabad, has a high rate of diabetes and hypertension, I am sure this machine will be extremely helpful. Thank you so very much. All the best to VISTA and Dr. Vijay Bhaskar.